One of the newest concerns in the fight against the coronavirus is the variants of the disease that keep popping up. Stanford researchers are leading the way in screening and diagnosing samples of COVID-19 variants from the United Kingdom, South Africa, and Brazil. One of those researchers is Dr. Benjamin Pinsky, medical director of Stanford Clinical Virology Laboratory, a native of Metro Detroit, who grew up in Farmington Hills. Doctor, we're very excited to have you here tonight. Thank you for your time.
Thank you.
Let's begin with the testing of the new variants of the disease. Your lab has identified the UK and Brazil variants in the San Francisco area. Help us in layman's terms. How do you identify them, and should we expect that we'll see additional variants in the months ahead?
Yeah, we've been taking a two-pronged approach to identify these variants. We do targeted testing, very similar to the RT-PCR nucleic acid amplification testing that are used for diagnosis, as well as using next generation sequencing or whole genome sequencing of the virus.
All right, we're already seeing it, but how widespread could these variants spread? How is your research helping to understand how they are working?
Right. The first point is to identify them. Fortunately, at least in our area, they've been relatively limited. Although, for example, the UK variant has spread to over 70 countries, and there's around 400 to 500 cases already in the United States. So some of these variants are more transmissible, and we expect to see them increase in prevalence in the United States.
To that end, a study out of Denmark suggests this mutation in the UK could make it harder to control with our current vaccines. Are you seeing anything like that in your research?
Yeah, there is concern with these variants that they may limit the efficacy of the existing vaccines. Although the UK variant, it suggests that that is still susceptible. One really important thing to consider about the vaccine trials is that the vaccines are very effective at preventing severe disease, even if someone gets infected.
But might we have to, I don't know, a booster or change the vaccine in some ways to eventually deal with these variants?
Yes, definitely. The vaccine manufacturers have been discussing that and have, I believe, started that process. It may be similar to what we see with influenza vaccines on a yearly basis.
We're waiting for a wider distribution of vaccines, but Doctor, in your view, do we have a handle yet on this pandemic, on COVID-19?
I think we're getting a better handle. Certainly, vaccine rollout has not been particularly smooth, but it is getting much better. We're doing our best to monitor for these variants in order to inform public health as well as our patient care.
And we know how quickly these vaccines were developed, really faster than anyone expected. Certainly, that's the good news here as we battle this pandemic.
Absolutely. The vaccines were developed on a scale that we haven't seen before, very rapidly. And again, they are very effective, along with continued masking, social distancing, and hand washing. That still works on the variants. So we should continue to do all of those things.
And just curious how closely you work with the Centers for Disease Control as far as sharing the information on your findings along the way.
Yes, we report all of our findings to the local public health officers, so they are able to identify individuals that have variants and contact trace their contacts. And that information goes to state public health as well as CDC. And then in addition, we put our sequences that we identify into publicly available databases to share that with everyone who is looking for these particular variants.
Yeah, and the work will continue. We thank you for your work, the work of your team in this regard, as well as we all try to get back to normal, or life as normal as possible moving forward. Dr. Pinsky, we thank you so very much for your time and again for your work in this effort.
Thank you for having me on.
Glenda?